This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, this is Heiko from the Acupuncture on Air show here on Radio Kidnappers, where each week we interview people and talk about different conditions that acupuncture can treat. We're continuing our series of great interviews that we've been having with a Melbourne registered acupuncturist, Ilana Sowter. Good morning, Ilana. How are you?
Good morning, Heiko. I'm great. I'm really happy that spring has hit here. Has it hit over there in New Zealand?
Well, we've just had shocking weather over here, haven't we, Ken? We've had 3 days of massive rains and winds, and Ken's been up this morning sweeping leaves. So Melbourne's different, eh?
Yeah, it's just nice, a little bit chilly in the morning and evening, but it's getting really warm during the day, and, it's getting lighter.
Fantastic.
Yeah.
Well, today we're going to be talking about a problem, of course, that's very, very common, and which is common for pregnant women, morning sickness, and the actual morning sickness symptoms affect up to like 80% of women to some degree or another, and hence it sort of it gets labelled as, well, that's normal, and again I think this can be a little bit an awkward position, but it's a bit like saying period pain is normal. I think we can say that it's common,
Yeah.
And but Chinese medicine, as we know, it takes a very different view of it, and it actually says, well, if you're having that, it's an imbalance in health, and therefore can treat accordingly. Now, what about you in your clinic, Ilana? Are you seeing more patients coming to you with morning sickness? Because I know there's been quite a few studies of research studies on acupuncture morning sickness. What are you finding in your practice these days?
Yeah, so look, in my practice, I generally treat women for morning sickness, or as it's known, nausea, gravidarum. If I've seen them for fertility and pregnancy, and they're just continually seeing me, and I'll treat signs and symptoms as they appear. But usually with new patients, they won't have that normal nausea, gravidarum. They'll have a severe form of morning sickness called hyperemesis gravidarum, where they get relentless vomiting, weight loss, can't hold the fluids in, and it tends to affect 0.5 to 5% of women. And it's interesting because the research shows that, for example, there was a recent study in 2019, this year, that, severe morning sickness is associated with a higher risk of the baby having autism.
Okay.
And I think it was 53% more likely to be diagnosed, and it was more so a stronger association for girls rather than boys. So things like this just illustrate that, I guess why it can be important for women to be healthy and, to be able to eat well and have a good pregnancy.
Because what I know, when I was in China working in a hospital there, it was just a norm that women came to the, we just call it, the Chinese medicine department in the hospital, and the women with, with morning sickness would see the herbalists, and so the thing is that. But what was interesting is that the women weren't going so much because they had the nausea, because I want to fix the nausea. They were going because if I am nauseous and I'm having morning sickness, that means I'm not healthy, and that means that means the baby won't be healthy. So I need to fix that. See, whereas now you're coming up with these data about the research that there are other connections to autism, whatever, and I'm sure there's probably many other contacts, and different problems that people can get as well as there. But I'm finding it in my practice here in New Zealand, and not so much when I was in Australia, that the women are very resistant and cautious about herbs for morning sickness. They're worried that they're harmful or dangerous or, can cause miscarriage or whatever. But now, what about you in Melbourne now? What's the general feeling there?
Look, I suppose it's a cultural difference because, when I look at the research now, most of the research suggests that if you have some nausea, it's actually better than not having any because there have been studies done where women who have no nausea are more likely to miscarriage than women who do have nausea. And obviously that's referring to mild signs of nausea and vomiting in pregnancy. Now, in terms of, so I suppose women who get mild nausea gravidarum, they're not so bothered about seeking Chinese herbal medicine because it's not affecting their life that much and, it's pretty normal. It's more so for the, the extreme cases.
Yeah.
And I think, for me, it was more so a case of women not being able to keep the herbs down. So I suppose they trust me and they know that the herbs that I supply are of high quality and they're stringently tested because the brand that we use, if there are any toxins or if there's something not right with the herb or they can't find good enough quality, they actually won't even make a batch of it.
Yeah, I realise that, yeah. And what I'm finding too is that one of the herbs that's become sort of very popular, like in the folklore sort of thinking, is ginger. And it's sort of like, but what's interesting there is that, and this is what I'll say to the patients is that, look, ginger is really well and appropriate and it works well when it's the right one for you. And the example that I always use is that if you've got, from our traditional point of view, a cold stomach, right? And then the ginger's really good because it's like warming, and then the cold stomach is causing the nausea. But if, on the other hand, you have a different diagnosis, a different pattern, which is like a hot stomach, and then these women and people that have ginger, they feel worse. And they go, I thought I was supposed to feel better when they have ginger. But I said, it comes back down to the, the idea of picking the right herb/formula for the individual needs. But, I know we're a bit pressed for time on the show, but maybe you could just tell us a little bit about just a couple of the common causes of morning sickness, according to traditional Chinese medicine.
Yeah, I think one of the most common ones would be stomach qi deficiency with empty cold. And
so that's just like a weak stomach.
Exactly, where they just feel slight, morning sickness. They might feel cold, a bit of nausea, maybe not vomiting, perhaps a little bit of vomiting as clear fluid. Mm-hmm. And then in the other case, it could be stagnant liver qi invading the stomach. And that is actually an interesting one. So something like that, you reckon, something like Shengjiang obviously isn't going to help it.
That's right, because the actual mechanism of it is coming from probably an underlying blockage of emotional energy affecting the liver, and then that affects the digestion. Would you say that?
Yeah, and it's interesting because I've had a few female patients with that presentation, and, they come because nothing works, like the ginger doesn't work. And obviously, and it's interesting because some of them are what they would consider as very healthy, as in they do a lot of yoga, they eat very clean, but they have stress or emotional tension. Yep.
Now, what about the different herbal formula? Now, because we've got different causes for what's the background to morning sickness. But give us maybe a couple of examples of some herbs or some herbal formula.
Yeah, well, a formula that I always used in the past, I probably don't use it so much now because I don't like using different brands. I tend to stick to the brand that I like because I know that it's the best quality. Mm-hmm. However, it's all in powdered, which is a problem because I think with morning sickness you have to give them pills or capsules.
Yeah.
But then there's the problem of you don't know how good the quality is.
Right.
But I always gave Jiangsha Liu Junzitang, which is for, the damp and the stomach And that actually would work. And I took that myself. I took that capsulized myself during my second pregnancy. I had no nausea in my first. In my second, I had it. I couldn't believe it.
Well, fantastic.
And, it actually worked. I probably took those capsules for about a week and then it went away.
So that's really, really good. Now, I know that, I think a lot of them could relate to what I'm going to mention now, and that is that, this water issue, because, it's the mantra these days that drink more and more water and keep drinking it till it's flowing out of your ears, so to say.
Yeah.
And we've actually had a radio show in here some time ago talking about this sort of people this is not in relation to pregnancy, but it's drinking too much water. And boy, that's the one that
some people do.
And that stirred up the most responsive of people ringing up and saying, "What's he talking about, saying you shouldn't drink so much water? Of course you should be."
It caused a bit of controversy.
But I find that with the pregnant women, because they've been succumbed to the mantra and the brainwashing. You need to be drinking, so it's like, oh, you got to keep your fluids up, keep drinking more and more water, and then they go, oh, but I drink water, I feel worse. I'm sure it makes me vomit more, and I know, of course, what's causing that, but maybe you can tell us about for this type of person. What's happening there?
Well, look, absolutely. And first of all, the most important thing to remember about that advice is, when it comes to health, as an individual, you know your own body yourself. So it's quite interesting that people will do whatever comes out in terms of health advice or research just because it's good for you. And it never fits everybody, does it?
That's right, yeah.
And people then are listening to themselves and they're actually not thirsty and they're drinking too much water.
Yeah.
So it's crazy. But essentially it would be because if a woman has, just in her natural constitution, too much damp, too much fluid, what we call the dampness in Chinese medicine, and basically her spleen energy isn't transforming and transporting food and fluids appropriately, and so she just naturally retains excess water in the body. And then when she keeps to try, drink water because it's healthy for her, she feels worse.
Yeah, well, I always equate it, it's like your body type or your constitutional imbalance at that time. You're like a wet sponge, and all you're doing is just adding more water to the wet sponge. And
right.
I know it's a difficult, and so the concept is we use some herbs that are in theory drying, if you like. But but it takes time. But one of the other concerns that I know women do have about the herbs is that they could be harmful or even cause miscarriage. And and then of course I know that there are herbs that are used to prevent miscarriage, but maybe you could just shred a bit of extra light on that for us, Ilana.
Yeah, I will. And before I do, I'll quickly mention that there has been some actually great research on acupuncture. Mm-hmm. So there's been a couple of big studies, with about 600 subjects where the women have been 14 weeks pregnant or under, for morning sickness, and so basically, they had 4 groups. They had so the subjects were divided into TCM acupuncture group, only pericardium 6. Another group was the sham acupuncture, and then it was a control group with nothing. And they were all randomised. Now, the study found that the women that had TCM acupuncture got the quickest result.
Yep.
And the quickest improvement. And from this study, because they monitored the women right up until birth, in assessing safety of acupuncture in early pregnancy, data was collected on perinatal outcomes, congenital abnormalities, pregnancy complications, and the newborn. And no differences were found between any of the study groups.
Right.
So, so we know for acupuncture it's fantastic. When I was in Sydney and we had a lot of pregnant women coming through, we would get them to come through 2 or 3 times a week when they had the hyperemesis gravidarum, and that made a good improvement. Now, regarding the herbs, I believe it's just a case of women not being aware of how important it is to go and see a professional Chinese herbalist who is experienced and is obviously aware that during pregnancy women need to have the best quality, safest herbs. And I guess that's why you can go and see someone as well, because it takes the responsibility out of your hands. Because if you're going to the health food store buying random products, or the Chinese store buying ginger, and you don't know where the source is, when you go and see a professional, you just completely remove all that risk.
Yeah, and that's what I stress too. I mean, the Chinese herbs are only as good as a diagnosis, and unfortunately, Google's not always that good on the on the diagnosis.
And it's actually stressful, because a lot of women, they can be stressed, and that can be exacerbating the morning sickness.
Yeah. So, but listen, I've got Ken over there, and he's waving at me. So
Ken.
We need to finish up the show soon. But again, look, many thanks again, Ilana. It's been great, and I know it's an extra effort for you to get up so early in the morning to coincide with the time change. But I just find these shows are really great for just helping to educate people and just get that knowledge out there. So thank you so much, Ilana.
Oh, thank you, Heiko. I really enjoy it, and it's always good to chat with you guys. And thanks for the support, Ken.
Yeah. Now we're going to finish the show with a song from Bjork, and I'm not even sure if Ken even knows who it is. You see, I mean that's why we get on so well, Ilana, because you know good talent, right? And the song that we've got is called Human Behaviour.
Oh, that's awesome.
But I just wanted to mention about Bjork, which I just read about, is that she actually started her career in a band in Iceland, and it translates as witchcraft. And then her first television appearance was when she was I think she was 19 years of age and very pregnant on stage singing this song, and it just how would you say, it was controversial. So here we have Bjork and the song called Human Behaviour, and we'll see you, Ilana, in 2 weeks' time.
Have an awesome day.
Great, thank you.
Bye.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.